February is American Heart Month. This is the month where we pay special attention to our heart health as part of our self-care, and it's the month where we set an example for those around us to do the same. And we really can't talk about a healthy heart without talking about a healthy head. Yes, that's our brain and our emotional well-being. Today, we are going all in on our health and our wellness, all coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
Heart disease is the leading cause of death for U.S. women. It's responsible for 1 in 3 deaths, according to the CDC. Heart disease kills more women than all forms of cancer combined. And a recent study in the Journal of American Medicine found that for women, being lonely and socially isolated can increase the chances of developing heart disease by as much as 27%. The finding adds that heart disease should be a part of a list of potential health effects of loneliness and isolation that also include dementia and mental health issues such as anxiety and depression. Now, despite these startling statistics, heart disease is often misdiagnosed. Today, we're asking experts why and what we can do to make sure we have healthy hearts. Here for my lead-off discussion is heart specialist Dr. Carol Watson. She is a UCLA cardiologist, and she was recently named Cardiologist of the Year. Good morning and welcome, Dr. Watson.
Good morning, and thank you so much for having me.
Well, first, congratulations on that honor, being named Cardiologist of the Year. How cool is that?
I was very surprised and very honored, and I especially was honored because my focus has been on cardiovascular disease in women, prevention, and the heart-mind connection for so long. So that was sort of validation that this is important and people understand that.
Yeah, no, absolutely. I can't be more thrilled that someone like you, who has dedicated your whole career to working on these really important issues, has received that honor. And since you mentioned heart disease in women, Dr. Watson, I know from the research that I did for this show that heart disease was traditionally considered a man's disease, and a lot of women weren't even a part of clinical trials. Has that changed, and has the perception that heart disease, is a man's disease? Has that perception changed as well?
So I hope it has changed, and I think it has. So that through a number of awareness campaigns led by the American Heart Association and other groups, we got the message. Heart disease is a disease for everyone, men and women combined, and it's the leading cause of death for all of us, regardless of what sex we are.
Do the symptoms of heart disease show up differently in men versus women?
Yeah, so in general, chest pain or chest discomfort is a major symptom for everyone. But for women, there are also a number of other symptoms that actually may be the most compelling symptom to a woman, like shortness of breath, like overwhelming fatigue, abdominal pain, things that may be nonspecific. But for women, heart disease can present in a number of different ways. So I tell all my patients, if you have any abnormal symptom from your nose to your navel that comes on with stress, either emotional or physical, and goes away with rest, you got to think about your heart.
Wow. Is that why heart disease is often misdiagnosed in women, because it presents itself in different ways than just your typical chest pain?
Yeah. So in medical school still, we're all kind of taught the classic Hollywood heart attack. Someone clutches their chest and falls to their knees and can't move. And that's what we think of. We don't typically think of overwhelming fatigue, abnormal sweating, shortness of breath, things like that. But again, we need to have an extra set of antennas up for women because the classic symptoms may not always be there.
If you have some of those symptoms, again, with respect to women that you just described, and you get to a hospital, is there like a window of time that the emergency room or a hospital can either reverse a heart attack that's happening or prevent it from causing permanent damage?
Exactly. Yes, there is. And we call that an aborted heart attack Because if we get there in time and give you the right drugs and do the right procedures, we can abort a heart attack. So it's absolutely vital that the symptoms are recognized right away, that people seek care right away, and that there is an appropriate response to those symptoms.
What is that time frame? I mean, do you have 20 minutes? Do you have an hour?
No, so we really like it to be, within an hour, but 2 hours we can stretch it to. And in any case, we think time is heart muscle. So the longer it takes to get evaluated, treated appropriately, the more heart muscle that can die. So the sooner the better. We'd love it to be within an hour, but get there as soon as you can.
So I've been to emergency rooms with family members who have complained about chest pain. If you go into an emergency room and you say you're having chest pain, they're going to put you at the front of the line. They're going to get you in right away. But if you go in as a woman and say, my stomach hurts, I feel tired, you're not likely to be moved to the front of the line. So what should a woman say who's going into the emergency room or even calling 911 and they're having some of these more traditional female symptoms, but not the chest pain that is the Hollywood heart attack?
Yeah, so whether it's a man or a woman, chest pain is usually part of the constellation of symptoms that someone will have. It just may not be the most worrisome. So a woman may have chest pain, abdominal pain, sweating, and fatigue, and say, this sweating, this fatigue, I can't stand it, and not mention the chest pain. If chest pain is a part of the constellation of symptoms you're having, always mention it.
Always talk about the heart, because that's going to move you to the front of the line and get you immediate attention. Whereas the stomach pain, the fatigue, you could sit in a waiting room if it's busy for several hours, which, as you said, time is of the essence. What about COVID? Lots of reports out that there is some direct correlation between people who have contracted COVID-19 and heart conditions, heart disease, or complaints about symptoms that are similar to some of the heart problems we're talking about.
Yeah, that's very true. So COVID is a virus, and that's the same thing that causes a lot of inflammation all over the body, including the heart potentially. So COVID can attack the heart, causing COVID myocarditis, you may have heard of. That's an inflammation in the heart. And that will cause a lot of symptoms that can mimic a heart attack, can be a heart beating really fast. It can be a lot of different things that cause the heart not to function as appropriately as it should. So again, COVID is a worrisome disease for so many reasons, but its predilection for affecting the heart is one of them.
And is that with respect to even the mild COVID that some people report, those folks that said, I really didn't have any symptoms, or my symptoms were so mild, they dissipated within 2 or 3 days? Are those COVID patients likely to have the heart conditions you just described?
So likely, probably not, but is it possible? Absolutely. I've seen many people who had almost as an afterthought mention, oh yeah, and I also had COVID back in December, but who have these symptoms of heart fluttering, heart beating too rapidly, blood pressure falling, things like that, which are undoubtedly post-COVID symptoms, but they didn't really think of it that way because their COVID case was so insignificant, they almost forgot about it.
Right. What about younger women, Dr. Watson? When you're younger, you don't tend to think about any condition, and definitely you're probably not thinking, I'm a target or a potential, client, or I guess someone is going to have a heart attack. Yeah. But help us dispel that myth.
So it can happen at any age. And in fact, the group of people who are increasing their rates of heart attack the most are young women. Mm-hmm. Heart attacks in young women, again, can look very differently from men, can be a different mechanism. It's often a tear in the artery wall, and often it's related to stress. So stress is a big worry for everyone, maybe even more harmful for women.
And are we seeing an increase because of stress related to the lockdowns and the pandemic?
We are seeing an increase in stress overall for a lot of reasons. It's a global pandemic, and that's to be expected. But I think what we are understanding is that the heart-mind connection is so powerful that this increased stress on a global level is going to increase our heart risk. We've seen an increase in the rates of heart attacks and strokes and all cardiovascular conditions over the course of this pandemic. A lot of it, there's some of it related directly to the virus, but a lot of it related to the overwhelming stress that we're all under.
And I read another startling statistic that 60% of stroke deaths are in women. Why are strokes so prevalent in women?
Yeah, that's another thing that's very concerning. So it tends to be that young and middle-aged men have more heart attacks than strokes, but young and middle-aged women have more strokes than heart attacks. Strokes have always been more common in women than men, and unfortunately, that's not always been recognized. But the same set of risk factors that go into heart attacks and strokes tend to be, shared. So high blood pressure, high blood cholesterol, diabetes, overweight and obesity, inactivity, all of those things are risk factors for both heart disease and strokes.
Well, we know the whole country has experienced higher levels of inactivity because of COVID, because of the lockdowns. What are you recommending that people do? Those who aren't going to work, aren't going out as frequently because of COVID. How do you get that level of activity that will make your heart healthy?
Yeah, I try to get everyone to move. Here's our motto: move frequently, eat thoughtfully, connect deeply. And moving frequently is what it's all about. And that means walking all the time. And even in the setting of COVID, most of us can find a safe place to walk around, whether it be an indoor mall or an outdoor track or out in our neighborhood. Most of us can walk around. And that is honestly one of the best sources of exercise you can get.
Even so, there's a lot of studies out there and a lot of debate about how much cardiovascular exercise you need. What school of thought should we follow? And some say 20 minutes a day, some say 30 minutes a day, some even say 10 minutes a day. What is the number that we should be targeting?
So again, more is better, and moving at all is important. But the American Heart Association and others recommend you get 30 minutes of moderate intensity physical activity on most days of the week. That's about 150 minutes per week. And that will give you the best chance for optimal health. But I don't want anybody to say, oh, I can't get in 30 minutes, so I'm just going to watch TV. 10 minutes counts, 5 minutes counts, every bit counts. So just keep moving.
And is there a difference in, you said moderate cardiovascular exercise or movement activity, walking versus running? I think walking sometimes gets a bad rap, reputation. People think walking isn't doing anything. It's not strenuous enough. Is that true?
No, so walking is a good exercise. If you've ever watched a young child start to learn how to walk, you realize how much muscle coordination and balance and everything it takes. It's actually a total body exercise. So the best option is to get a brisk walk in. And we like to use the old Bee Gees song, Staying Alive. So you're walking kind of at a brisk pace. You're not strolling, you're kind of getting it in. And many studies have shown that if you expend an equal number of calories with walking and running, the cardiovascular benefit is the same. The difference is you can expend that number of calories in about a quarter of the time by running versus walking. But if you get the equal energy expenditure with both, they're both equally as beneficial.
So I know the American Heart Association has a lot of resources and information. How do people find those resources?
Yeah, you can get everything off of the American Heart Association website. Just Google that in your browser and it'll bring up a wealth of important information for us all.
Finally, Dr. Watson, is there one or two things that you wish all of us Americans would do so that we don't end up in your office?
Yeah, I do. I think there's so many things we can do to prevent disease that I think everyone should get a cardiovascular assessment by whatever healthcare provider you see. That includes getting your blood pressure, your glucose, your cholesterol numbers, your physical activity assessment, a stress level assessment, and try to get those all in tip-top shape because that'll help us lead long and healthy lives.
Well, thank you so much, Dr. Watson, for that great information. Again, congratulations on being named Cardiologist of the Year Keep spreading this good advice. It's going to save, as you already know, so many lives. Good to see you, my friend.
Thank you so much. It's great to see you again, and thank you for doing this program.
Thank you. All right. We're talking about women. We're talking about health. We're talking about wellness this morning. My next guest, Dr. Daihnia Dunkley. She's a lecturer at Yale School of Nursing, and Dr. Tia Delaney. She's the Director of Diversity and Inclusion, Alzheimer's Association. Good morning and welcome, Dr. Dunkley and Dr. Delaney.
Good morning.
I want to start by just talking about some of these alarming health statistics. As I was looking at the stats around heart condition as it relates to women, particularly women of color, you can look at statistics around Alzheimer's. There's a new study out that shows that women of color are more likely to get some form of dementia, Alzheimer's. There's so many terrifying headlines related to Black women and health. I'm starting to think, can some of this information actually be detrimental to our health? Dr. Dunkley, what do you think?
I definitely think that there's the opportunity there for an internalized stress, just thinking about these things, right? But that's part of the intersectionality of being a Black woman in this day and age, is that our identity, just by being Black and female alone, there's an inherent level of stress related to living in today's society. So when you compound that with some of the statistics that you just mentioned, there's absolutely, I agree with you.
Yes, I'm wondering, Dr. Delaney, do these headlines have the potential to create a fear amongst women, that fear can that fear become some form of chronic anxiety that then leads to some of these other conditions, high blood pressure, and some of the conditions that Dr. Watson talked about?
Yes, Areva, that is so true. And, we have to do our due diligence to not allow fear to become that barrier. I find that you read the headlines, but a lot of times we don't, dive deep enough to read the story. And so the headlines can really create fear and create a barrier for a lot of us of not wanting to know, and then minimize our thought process of going to a doctor and getting a diagnosis. And without a diagnosis, then you can't begin the treatment and the planning and the interventions. And so I really educate my, patients to really go further into the story and take away from it what you can to empower yourself. Look at what happened and how can you use that information in case you find yourself in that situation or your loved one. What did you learn from this story that's going to help you be a better advocate for your health?
Yeah, that's a great point in terms of not just stopping at the headlines and actually going deeper to read the story. And one of the things that I think Dr. Dunkley, help us understand is even when we see those statistics, they're always environmental, genetic, behavioral, and other factors that sometimes aren't mentioned in those articles or may not make those articles relevant to you. So how do we read these headlines and take into account these other factors?
Absolutely. And I think one of the most salient points here is to realize that a lot of times the information that's presented to you in research articles is not inclusive of Black women and Black bodies. That fear of mistreatment that has been historically proven sometimes keeps us away from participating in research that is could be helpful in finding out different things like you mentioned about our genetics and biological factors. But I certainly think that filtering that information through individuals that work in healthcare, who are professionals, and seeking the advice of qualified individuals rather than the clickbait that's out there these days, and trying to do some of your own research to really understand it will help as well.
Yeah, I know, Tia, one of the statistics that I've read a lot, and I'm sure a lot of Black women have, is the number that 40% higher mortality rates for Black women with breast cancer. Again, if you see that number and you are due to get a mammogram, been thinking about a mammogram, that number can cause fear, like, oh, maybe I don't even want to know, or maybe I shouldn't proceed with this examination. Like, how do we take that number and put it in proper context?
Well, again, I always say knowledge is empowering, right? And so if 40% of women, may be at risk for developing breast cancer, you want to know, are you in that 40%, right? And so you need to then use that information to see what you need to do to determine if you are or if you are not part of those statistics. And I really encourage women to really know their baselines. And that's one of the things that's going to get tested. Know your baseline for your blood pressure, for your blood sugar, for your thyroid panel, for your cholesterol. And that's, again, getting those mammograms so that we have comparison data. A physician needs to have your baseline mammogram so that 3 years, 5 years down the line, if there is something that's irregular, they have something to compare it to. We don't want to wait till we're 60 years old to have our first mammogram, and then there's no other, data or studies to compare it to. So, I agree with you, Areva. These headlines can be very frightening, even as a clinician. But again, I always come from the perspective of knowledge is power. And, as women, we have our voices. And so we need to make sure that if we're confused about something, when we go into these appointments, to say something.
No, great point. And Dr. Dunkley, even when you think about Black men, I know that there was a lot of literature out that said that Black men were amongst the group of people who were least likely to go for regular checkups. Have you seen anything change with respect to those stats?
Absolutely. I think there has been an awakening now when we see the untimely deaths of younger Black men, and certainly with Chadwick Boseman, one of the major figures that we've seen in terms of preventive screenings and early diagnosis. I think that the narrative is starting to change, where the stigma in terms of seeking medical guidance and going for your annual checkups is starting to change, which may be one of the benefits of social media and us being so much more connected. And some of that clickbait that you're seeing, they may have some positive effects. But I certainly don't know the long-term statistics on that in terms of the data. I'm not sure if anybody is measuring that, but certainly socially, you're seeing conversations starting to there's an uptick in making sure that our Black men are going for those checkups.
Are you seeing that, Tia, at all in your practice? Are you seeing more Black men coming in, getting wellness checkups?
I don't have a practice, so I can't say it from that perspective. I can't provide you with that information, but I can tell you that more men are talking about their health. And so I really get people approaching me and wanting to talk about diabetes and high blood pressure and when they should go in and get a prostate screening. And so that's always encouraging to me. Before, we would see that Black men weren't even having conversations about their health. And now what I see in my patients and their families is that they're encouraged and they're excited about knowing what they can do to minimize their risk factors and how they can play a role in managing their health. So I can speak to those changes, Areva.
Yeah, that's positive and good to hear that. I know, Tia, a lot of the work you do is with aging population and illnesses related to aging, like dementia and Alzheimer's. What are some of those statistics that we need to know about dementia for people who may be thinking that they're seeing changes either with themselves or their loved ones?
Right. Thank you for asking. That's a great question. So some of the statistics that are really important, and again, I want them to be empowering, are that Black and Hispanics, have a higher propensity for developing Alzheimer's disease and other dementia than any other races. Blacks have a 2-to-1 propensity for developing in comparison to their white counterparts, and Hispanics 1.5 times. And another figure is that women, 2/3 of the people dealing with Alzheimer's disease are women. And so we have 16 million Americans right now dealing with Alzheimer's disease. And so that's about, like I said, 2/3 of them are women. And so it's important to understand those non-modifiable risk factors related to age, and gender and race, because then I think it allows us to look at the things that we can change, those modifiable risk factors. So me, knowing I'm a Black woman, I'm in the highest risk factor for developing Alzheimer's disease. So that really makes me know that I need to look at my cardiovascular health, my exercise, my sleep, so that I can minimize those other areas of risk.
So stress, obviously, I would imagine plays a big role, as we talked about earlier with Dr. Watson. Dr. Dunkley, we hear stress so often. I wonder if we now have become, we're kind of tuned out. We tune it out because when you go to the doctor and you have a complaint, they always ask you, well, are you under stress or what's your stress level? How do we put stress in the proper context?
I don't think we understand the overwhelming effects on the body that stress can cause, right? We talk a lot about maternal mortality and morbidity amongst Black women. And some of the effects of it or some of the contributing causes are due to the weathering that happens in our bodies, right? Over generations, right? It changes our DNA even, where our bodies just start to deteriorate a little bit faster than our non-Black counterparts. And I think that until we internalize like how important mental health and having a life that is peace-filled can have physical effects on your body. It's the reason why we are at higher risk for these vascular disorders that you discussed earlier, but I don't think that folks kind of understand the extreme importance of living stress-free. Yeah.
So I'll ask you, Tia, how do we live stress-free? I think that's the big question we're all always asking ourselves.
If I had the answer to that, Areva, I'd be wealthy.
I tell you.
But you know what? I think we also have to look at, I love what Dr. Dunkley said, but I think we also have to look at stress and have a lot of cultural sensitivity when it comes to stress. A lot of us come from a place of privilege where we can think about stress and managing our stress and what it really looks like. But when you're talking to a single mom with 2 jobs and children and having to go to work and manage a household, telling her to manage her stress is like, wait, I'm living in stress. It's part of my way of actually living. It's how I'm going to survive, right? And Black women, we come from that survival mode. So, how to live without stress, I think one is to be mindful of how stress can manifest itself in you, looking at your behaviors. Are you becoming more agitated, more restless, how you're speaking to others, looking at how much you're sleeping. And so you may not think you're stressing out, but if you're only getting 4 to 5 hours of sleep, you're under some type of stress, right? Looking at, I always look at my skin too, Areva, do I seem, like my skin's not having good color and I see, so those are some things we can do to really assess, are we under stress? But again, when talking to our physicians, as Black women and as Black people, when they ask us, are we under stress? I think as clinicians, we really have to have that cultural sensitivity as to what is stress and what really can be managed, Areva.
What do you think, Dr. Dunkley, of some of the applications that are on the market, apps that people can get on their phones that talk about mindfulness, that walk you through a process where you can breathe, or yoga classes? I saw that a lot of people are using yoga, and actually even tattoo artists and these different alternative non-medical ways to manage stress. So let's start with the apps. What's your impression of how helpful those apps are?
I can tell you, just in my social network alone, a lot of us are using Calm. That, I'm not, recommending any brands, but we talk about apps like those. I say use whatever is helpful to you, right? Some folks may not, respond the same to that app in particular, but there may be something out there for you. So I would say do the research to see what is out there. You mentioned yoga. Exercise, dancing is a huge, stress reliever. So if you're not into maybe the traditional exercise, find a dance class, do music therapy. There are so many ways to address stress and in unique ways. And so whatever works for you, I say find it. Therapy. Therapy is not a dirty word. If you need outside help, we have to remove the stigma from seeking those assistance from those resources. So I say whatever works for you, mix it up, and try different things. I want to just revisit that whole notion of Black women kind of normalizing stress. We've been taught over time, through our families to just let it roll off your shoulders, right? And be resilient. right? But we have to start to change that narrative that we don't always have to be strong, right? It's okay to not be okay. It's okay to be soft sometimes, and you know, and to delegate things. We tend to try to do everything ourselves. If you can afford to, get a housekeeper. You know, it's not a luxury, right, to delegate certain things, and you're not lazy for doing it. So I think conversations like that need to also happen.
Yes. Yes.
Absolutely. And you're right, Tia, that some of these things are related to one's privilege, one's stature, one's socioeconomic class, where some people are able, even some of these apps cost money. So some medical providers make them free to their patients, but not all of them. Some of them have a
Right.
monthly subscription price, so they're not always affordable for everyone. And some of the yoga classes, some of these things, you know, just cost money. So it's not affordable for everyone. But are there some simple things, Tia, that everyone can do despite their socioeconomic status that you would recommend, whether it's deep breathing or we talked about exercise, walking obviously is free. You can walk around even in your home. But what are some things that people can do that don't cost money?
Yeah, and I agree with you. Thinking of things that we all can do. And so walking to me is number one. And I heard the doctor speaking about that earlier. In your community, even if there aren't any parks, just walking around where you live. I encourage people, if you watch a lot of television, to get up in between commercials and have some light weights beside you and doing some little lightweight lifting. Taking those moments to do deep breathing and finding that time in your day, even if it's just 10 minutes between shifts. In the mornings I get up and the house is still a little quiet, and I take 10 to 15 minutes to just either deep breathe or listen to a free podcast.
Can you walk us
about
through a
mindset.
deep breathing exercise? You and I and Dr.
Definitely.
Dunkley and everyone's watching, we can all just take a moment. Come on, Tia, help us.
Yes,
Okay,
please.
so the first thing is I focus on my word of the day. So is it gratitude? Is it love? Is it empower? Whatever it is, I focus on that word. And then I just take a deep breath in with my eyes closed. So you just need to make sure your shoulders are relaxed, because that's something we don't do. Relax your shoulders. And then that deep breath in, deep breath. And the whole time you're breathing in, I want you to think about your word and just repeat it over in your brain. So if it's love, love, gratitude, gratitude. And then you're slowly exhaling and you're again repeating that word, love, love, gratitude, whatever it is, and keeping your eyes closed and trying to do that at least 5 to 10 times. And it's not a race. You're doing it slowly, and remember to keep those shoulders down and your feet firmly planted on the floor. And that really helps to center you. And I've found that you can use this exercise when you are under those stressful conditions. Sometimes you may need to go to your car or maybe need to go to the bathroom, but then you can do that deep breathing in, thinking of your focus word, and then you're deep breathing out, releasing it, and allowing yourself to calm yourself. And it is found, and studies have shown that deep breathing and those exercises really can help with your blood pressure, can help in, giving you maybe a few years back on your age. And so I really encourage it.
Wow, that's great. And yeah, I like that you find a word that you can focus on, because I think one of the things that happens to all of us is when we try to, sometimes we get so distracted with our calendar and all of our to-dos for today that it's hard to just tune everything out and focus on a particular word or a particular thought. So thank you for leading us through that exercise. I want to talk about some of the other issues that come up, particularly as we see people start to age. And I know both of you have dealt with this, and that's the issue around getting people to acknowledge when they need help. I did a whole show on dementia and the warning signs and how do you get people help. And I had a bunch of people call in or contact me and say, Areva, let's talk about, though, as people are starting to have changes in their mental capacity, how you as a loved one help them, power of attorney, health directive, all of those things that you need to have in place. Let's start with you, Dr. Dunkley. What recommendations can you give to a loved one that is dealing with, as a caregiver, a family member that may be experiencing some of those changes, but they don't recognize it, they won't acknowledge it, and they're holding tightly onto their bank accounts and other responsibilities, but yet not really able to handle them?
Yeah, it's a great question because I'm currently helping to support some of my own friends and colleagues who are going through this right now, and it's very difficult. Sometimes when you're kind of teetering between, the person still has decision-making capacity, but sometimes those decisions aren't the best for their health. And from the outside looking in, it's very difficult. But I would just encourage any caregivers out there who are dealing with a loved one who has some memory loss issues, to stay the course, try to find support groups that offer resources to caregivers that can help guide you in those difficult conversations, because you do need to have those things in place. It's, it'll be even more devastating if, God forbid the person should pass and you don't have any mechanisms in place for handling their estate. So although the conversations are difficult, they're necessary. And certainly, bonding with individuals who have gone through the experience before is important to the caregiver's mental health as well, just for that sense of community. But definitely, trying to redirect the person, to have the difficult conversations, because we should all have.
Right.
Yeah, I know, Tia, that's something that your agency deals a lot with. Can you give us 2 or 3 of the top tips that you use to get families through this process?
Yeah, definitely. So the Alzheimer's Association has tons of resources geared just for this area. And so you can go to alz.org and we have tons of resources. One of them is entitled Dementia Conversations. And it really helps those caregivers learn how to start those difficult conversations, but also how to stay the course. And so one thing I encourage those who are dealing with a loved one who's starting to show some confusion and memory loss and early signs of Alzheimer's disease or dementia is to start keeping a journal of this information, really tracking those changes. Because when you start the conversation with someone, you want to be factual and not accusatory, right? You want to say, for the last 3 months, this is what I've noticed, or 2 weeks ago, I noticed this, not, well, I think and so starting those conversations by keeping that journal. The other thing is to really be honest about what you're seeing and why you want to help that one get a diagnosis, because like you were saying and Dr. Dunkley alluded to, is getting those DNRs and power of attorney and having the conversations about wills and estates are going to be imperative, because with Alzheimer's disease, it progressively worsens. And I always say to someone, you want to be part of your care planning decision and process, right? Your loved one wants to be part of it. So bring it up early, start the conversation soon, so they can be part of the planning. They can tell you what they want and how they want their end of life to look and be able to move through the disease with grace and integrity and dignity. So those would be some of the things I would advise someone dealing with this disease.
Yeah, absolutely. The earlier you can have that conversation. As a lawyer, I've had to advise many families through this process, and it's so difficult when the person, sometimes people are in comas or they are in a state where they can't make decisions, they can't give you power of attorney, and it can really create just a nightmare for families as they're trying to resolve things around property, or it could be bank accounts or pensions, life insurance, is there insurance? So there's so many issues that need to be discussed. And I know there's sometimes a taboo, or people think, oh my God, if I talk about this, I'm somehow hastening my demise. Or
Yes.
if I talk about my death, I'm going to cause my death. And absolutely positively no correlation between having smart and thoughtful conversations and whatever happens to your health. They're completely independent. But Dr. Dunkley, how do you know if stress or medication is causing some mental changes versus it being a neurological process like dementia? How do you make that distinction?
Absolutely. I think, as Tia mentioned, having a journal or a way to document so that you can see trends over time is probably one of the best ways to do that. But just trust your gut instincts, right? If this is a close loved one and you think that there's something not quite right, but you're not sure how to put it into words, trust that feeling and investigate it anyway. It may turn out to be nothing, but you don't want to miss those subtle nuances that could be warning you of something important. So those would be my suggestions.
Are there particular warning signs? We know Dr. Watson talked about some of the symptoms with heart disease. Tia, are there warning signs of dementia?
Yeah, there are. So, as we get older, we think about, oh, we get older, we get forgetful. And so dementia really is not about being forgetful. I use the words retrace, remember, and recall, the three re's. And so you begin to be unable to recall and retrace and remember. And that's going, for words. You can't remember the correct words to use. You can't remember how something got into a particular place. So, you or Areva may go in the house, put your phone on the counter, go do something, and where's my phone? And then you think, oh, my Lord, think, pause. Oh, it was in the kitchen. You go to the kitchen and there's your phone. When people begin to have cognitive impairment, some type of dementia or Alzheimer's disease, that ability to recall and retrace begins to leave. And so in the early stages, we're really aware that this is happening to us. And so we really need to be aware of, are we losing our ability to recall and retrace and remember? You may also notice that your loved ones are really withdrawing from events and activities like social activities because they're afraid that you're going to notice what they notice, right? And so they're not attending birthday parties or at work events. They're not, doing that. Well, with the pandemic, we're not doing anymore, but that was those water cooler conversations. And it's really because they're afraid that you're going to notice. Are they going to lose their job? Are they going to lose their independence? And so looking at that person, are they using a lot of Post-its? Are you noticing they're using a lot of things to remember? Is grandma no longer making that favorite recipe anymore? Because, back in the day, they had a pinch of this and a dibble of that. We didn't have a recipe book. So maybe now grandma's not remembering the pinch and the dibble, And so looking at those signs and thinking, is something else going on here rather than just someone getting a little older and forgetful?
Those are great things to look for, Tia. Dr. Dunkley, how do you get someone who you notice is experiencing that to a doctor? Because if the person is withdrawing because they know it's going on and they're purposely trying to hide it from their spouse or their children or their coworkers, they're not likely to want to go and sit before a clinician and talk about it.
Right. Yeah. And this is where it gets really tricky and difficult to manage because you're wanting to preserve that person's autonomy to make decisions about their own health. But I think that exercising patience is really, really crucial. And just being honest and transparent. I think that if this is someone who trusts you, right, you can deliver the message from a place of love and just genuine concern. And, like Tia mentioned, listing some of the things that you've noticed, in a way that is not brutal to the person's ego, but and just in a loving way, and really expressing that you're concerned. And you would even go with them if they're fearful, or if they're not sure what questions to ask, or, if they don't understand the information that's being exchanged, you'd be more than willing to serve as a proxy, and just from a place of support and love. I think, just from there, allowing the person to make the decision, but still keeping a watchful eye and supporting them. And just being there for them. I really can't, maybe Tia has some other suggestions, but this is the hard part, until that person is no longer able to make decisions for themselves, you do have to respect their wishes, but always be transparent and watchful and supportive.
Yeah. Anything you want to add to that, Tia, in terms of how you can nudge someone? I went through something very similar with a loved one, and the biggest fear was driving. Fear that the doctor would make a report to the Department of Motor Vehicles and her license would be revoked. And a lot of people who have their independence and who are driving worry about that. And also, one of my relatives also told me, an elderly relative, be careful about calling law enforcement on me, or if you think something's wrong with me, because fearful that if fire department, police go into a home and see an elderly person living alone, they too may make some kind of assessment and some kind of referral to the Department of Aging and determine that this person can't be alone. So those are legitimate fears that people have as they start to age about being in a situation where they could lose their independence because some outside entity or agency comes in.
Yeah. And that is so true. And we could do a whole nother show on just those two topics, the fear of losing independence. But I agree with what Dr. Dunkley was saying is coming from a place of care and support and love. But when you're talking about driving, I really encourage people to look at it from the perspective of you want to ensure your loved one is in the best space. And that means you want to make sure they're not going to be in a place where they're going to cause harm to themselves or to someone else. One thing you can do, and I really encourage people to do, is when you have that conversation about driving, is to have some alternatives, because they're going to be like, well, how am I going to go to the store? And how am I going to get to appointments? So, if you have the privilege of having that family support and those friends support, or reaching out to the Alzheimer's Association for other transportation resources, so that when you begin that conversation, you have those answers. Yes, you're going to need to go to the grocery store, but on Wednesdays and Saturdays, me and John are going to take you. We'll take you to your doctor's appointment, or Aunt Beth is going to be taking you once a week out to dinner. Have some alternatives for that person, because their independence is of value. And that's going to be one of their biggest fears. How are they going to be able to do the day-to-day? But I found what really also helps is saying to them, do you want to be responsible for hurting someone else? And they don't. And really saying that you want to keep them as independent as possible. And this is not to take away their independence, it's just to help improve their safety.
Yeah. Is there anything that people can do in terms of online tests or quizzes or any kind of assessment that they can take that gives them some sense of their baseline? Or do they have to go into a facility or a clinic or medical office to get that baseline assessment?
I'm going to tell them to go to the doctor, because if you're like my family and you're like Google WebMD, you'll wake up and you'll have a rare bubonic plague by the time you finish. So I really encourage people to go see their physician and just start the basic testing. The first memory test is really pen paper, and then from there, the physicians can determine if you need more neurological testing or some other diagnostic testing. But I really encourage people to make that appointment, but to go armed with information so you're not kind of foo-fooed away. If you really feel something is going on, don't just take, oh, you're getting old as a response. Say, no, I think something is going on and I demand further testing. Be your own advocate.
But don't go on Google and try to assess. don't do your own self-diagnosis.
Please, Areva, please no.
Okay, Dr. Dunkley, it's COVID. So some people don't want to go into medical offices. Some people don't want to go into emergency rooms. Unfortunately, I just had one of my childhood friends, her older sister died of a heart attack. She was at home having symptoms, called the hospital, found out there was a 3-hour wait in the emergency room, obviously didn't tell the people on the other end that she was having severe symptoms. And my friend finds her sister slumped over on her floor dead the next day. She had had a heart attack. So how do we make sure people are not doing that, not purposely staying away from hospitals because of what they may perceive as long wait periods, or I don't want to be around all those infected people? COVID has really changed the way we all move about the world.
Yeah, it's interesting that you said that, because I remember during, more of the height of the pandemic here in New York, many of my nursing colleagues were saying, all we're seeing is COVID. What happened to all the other sick people? Where are they going? What's happening? And I think a large part of that is because folks were scared to be around, the virus. But I would say that utilize the emergency room as it should be used, right, for those emergencies. But you can schedule appointments, and many providers now are doing telehealth visits where you don't have to leave your home. So if it's something like a screening that can be done through telehealth, take advantage of that and try to seek some providers who have that service available. But the wait times in the emergency room, I think a lot of people use the emergency room as primary care, and for various reasons. We could also have another show on that in terms of access and things like that. But, if you're trying to avoid that, try to find providers that are doing maybe telehealth, or schedule the appointment at a time that's convenient for you. And don't feel that you have to stay out of the healthcare system now. We may be overwhelmed a little bit, but, we're still providing care, and we still want folks to access the care that that they need, and not be fearful of seeking treatment because of the virus.
Yeah, and there's urgent care, obviously. There are
Right.
step down facilities.
Right, and that's another option. Mhm.
And there's the emergency response teams. You can actually call an ambulance, and those EMTs have training too. So they would have been able to, in my friend's sister's case, help, maybe they would have been able to abort that heart attack, as Dr. Watson said, or at least gotten her in to a hospital, and she would have gotten to the front of the line because they would have noticed that she is having a heart attack. So
Right.
we
Yeah,
definitely,
if you're not sure what to do, just call them anyway.
yeah.
It's better to be safe than sorry. So if you're not sure if it's urgent versus emergent, just go ahead and call, and they'll give you the help that you need.
Yeah, we talked a little about access. You're right. That's a whole big topic. But we do know, Tia, that a lot of people are afraid of the cost. They're fearful that they may get stuck with an ambulance bill, or they go to an emergency room and they don't have health insurance. They'll get stuck with a bill from the emergency room or from the doctor. What do you say to those people who are concerned about the cost?
Yeah, and I understand because I've worked in Los Angeles communities all of my life. Those are the patients that I've served. But you have to think about the bigger cost. If you're not here for your family or your loved ones, who's going to take care of your family? Who's going to take care of those loved ones? And after the fact, really work with the hospital or the EMT, the ambulance department. There's a lot of funding available out there, especially during the pandemic, that helps you with those hospitalization bills. It helps with those ambulance costs. And so, I say, like Dr. Dunkley, if you're uncertain, go call 911 or take yourself in and worry about the cost second, because I will say on that aspect, I have been really impressed with the amount of programs out there to help support these hospitalization costs and the cost of ambulance services.
Yeah, I'm glad you mentioned that. There are programs available at the local level, at your state level, and even the federal level to pay for a lot of the costs associated with healthcare during this period. Thank you so much, Dr. Dunkley. Thank you so much, Tia, for joining me. Such an important conversation. And this is Health Month in America, and we are raising awareness about health, healthy hearts, heart conditions, and other conditions that can cause one to suffer a heart attack or have some of these other chronic illnesses. I don't think we can have these conversations enough, because as much as we talk about women being, dying from heart disease in such startling numbers, my friend's sister still just died of a heart attack without seeking medical care. So I think we just have to keep reminding people what those symptoms are and encouraging them to seek help, because I keep thinking that had she gotten to a facility or had she called an ambulance or something, maybe her life could have been saved, because she didn't, according to my friend, have any other chronic illnesses. She was perfectly fine that morning, that afternoon. So there was no indication that this woman, who was maybe in her late 50s, was going to die. So
Yeah.
Sorry
And I've
about
seen that happen too. I've seen that happen. And so I'm so glad that you're providing this platform to be able to provide that education and resources to those who may be right there in the middle of deciding whether to make that phone call or not. So today's conversation could have saved a life. And so it's important to have these conversations. So thank you, Areva.
Well, thanks both of you for joining me as we try to educate and raise awareness about how we stay healthy as women and as a community. Because we know if the women in the family is healthy, she's going to make sure everybody else in that household, the kids, the husband, the grandparents, the aunts, the uncles. So let's keep mom healthy. And that way we make sure the family is healthy, and the family's healthy, the community is healthy. All right. Thank you, ladies, again. I want to thank all of my guests, and thanks to all of you for joining. Again, the month is almost over, but we wanted to make sure that we did our part to talk about healthy hearts and to talk about how important it is to prioritize your health, not just in February, but throughout the entire year. There were great resources that were provided by the guests this morning. Make sure you check out those resources. And if you know someone in your family who is suffering from a chronic illness and is not getting help, encourage them, talk to them, nudge them, love them to death, and be patient, as Dr. Dunkley said, but also try to get them in to a hospital, into a medical facility, into a medical appointment, because we know preventative care can actually save lives. And just some really quick words to live by. We all know our health is our wealth. So if you want to be super, super wealthy, take care of your health. All right, y'all, I'm out. Be safe out there. Wear your mask, get your booster shot, and remember, we're all in this together.